This video is all about coughing in cats, and it's important that you watch it because coughing in cats is not a normal thing and usually signifies some sort of problem. My name is Dr. Sarah Wooten. I'm a small animal veterinarian with over 20 years experience, and in this video, we're going to talk about the causes of coughing in cats. We're going to be talking about how the coughing is diagnosed, how it's treated, and how to prevent coughing in your cats. So let's get into it. Cats can cough just like people do. Any irritation of the respiratory tract from the nose all the way down the windpipe into the lungs and the bronchioles, any irritation along the way can cause a cough. Coughing, now I know I said coughing in cats is not normal, but a cough like once every few months or even less frequently is probably not a big deal in your cat. But most cats do not cough repeatedly unless something is wrong. Notice a cat's respiratory system, it goes all the way from their nose, through the back of the throat, down the windpipe, into the lungs, in the chest cavity. And anytime there's an irritation anywhere along there, they can get a cough. And different areas of the respiratory tract cause different types of coughing. So it's also important to know that coughing in cats can be confused with other things that cats do. So let's talk about what coughing actually looks like in cats. A cat that is coughing or has a cough will usually stop whatever they're doing and they'll stick their neck out like this and they will cough. And you might hear one cough, you might hear multiple coughs, and if your cat is coughing multiple times in a row, they will not move anywhere else during it. They'll either stand or they'll sit while they're doing it. And there's two types of coughs in cats. There's actually two types of coughs, period. It doesn't matter if you're a cat, a dog, a human, whatever. So there's a dry cough and there's a wet cough. A dry cough is like a hacking cough. It's like a honking, it can be wheezy, and a dry cough, our most common example in veterinary medicine is dogs that get kennel cough have that dry hacking cough. It's just, and it's just there. Cats typically do not swallow after they've had a dry cough. A wet cough sounds exactly like that. It sounds like there's some fluid or something caught in your cat's chest or their throat. And maybe you hear some crackles or bubbles or something. And with a wet cough, which is often much more soft than dry cough, cats will swallow. They still won't walk anywhere or do anything while they're coughing, but afterwards you'll notice that they'll swallow. There's a couple of other things that cats do that can be confused for coughing, and those include vomiting. So it looks like they have whole body heaves, and they also have their head and neck extended, but something's coming out of the mouth. Fluid or food or stomach contents or fur, a hairball, something like that. Something will come out. Then there's also reverse sneezing. People are more familiar with reverse sneezing in dogs. It's when I'll demonstrate. It's a Hopefully I don't get stitched with that. But anyways, a reverse sneeze can look like a cough, but it's not. It's often due to allergies or just irritation in the back of the throat. And then retching, sometimes when they'll get something caught back there, they can do the same kind of thing. And sometimes there's a little bit of fluid that comes out. Those three things can be confused for coughing. So if you are noticing that your cat is doing something that could be coughing at home, the best thing that you can do is grab your phone and then take a video of it and give it to your veterinarian, because that will help them differentiate between coughing, retching, gagging, reverse sneezing. Let's talk about what causes coughing in cats. This is a pretty extensive list. There are a lot of things that can cause coughing in cats, which it always makes me chuckle a little bit when somebody comes up to me, at a party or something, and they say, "Hey, my cat's been coughing." And I'm like, could be about 40 different things. I I can't help you. Let me get my crystal ball. Still can't help you. So let's talk about the different causes of coughing in cats. One of the most common is respiratory infections. Bacterial, fungal, viral respiratory infections, very common cause of coughing in cats. Sometimes you'll get fungal or parasitic organisms that can be involved. Oftentimes these cats will have other signs of upper respiratory infections, including fever, runny eyes. Sometimes you'll see nasal discharge, but that's a very common cause of coughing in cats. Number 2, asthma. Cats with asthma will experience the same kind of thing. They'll get an asthmatic attack because there's something in the environment that's triggering them. Their airways will narrow, everything will get swollen, and they can cough. Though it's interesting, cats with asthma don't always cough. They are more likely to wheeze and just act very quiet, sometimes breathe with their mouth open, but sometimes they can also cough. Number 3, pleural effusion. Pleural effusion is the word for when fluid surrounds the lungs. So in the chest cavity, you have your heart and your lungs, and then around your lungs, you have space. And that's what allows air to come in and expand the lungs and then deflate them. Well, if that space gets filled up with fluid from any cause, infectious, cancer, parasites, you name it, it can cause coughing because it causes pressure on the airways. So pleural effusion is another cause of coughing in cats. An inhaled foreign object. So if a cat inhales something like a piece of grass is a very common reason, and it goes down their throat or it's in their nose, and it's tickling in the back of their throat, they can cough. They can also have multiple episodes of violent sneezing. Sometimes they can develop a bloody nose as well. So if they've inhaled something, that can cause coughing. Cancer, the big C, can also cause coughing. In fact, coughing is often one of the first symptoms that owners notice when a cat has cancer that affects anywhere in the respiratory tract or the lymph nodes that are inside the chest. Because if those get big, they can push on different parts of the respiratory tract and cause coughing. Another cause of coughing in cats, nasal pharyngeal polyp. These are inflammatory growths, either in the nose or in the back of the mouth or in the throat that can become irritated and cause coughing. Obviously, we've also got pneumonia, can cause coughing in cats, less likely to cause coughing in cats, more likely that they're just going to be quiet, have a fever and hide and not feel well and not want to eat. Bronchitis can definitely cause coughing in cats. A lot of times it's hard to tell the difference between bronchitis and asthma in these two, but both of those can cause coughing. Trauma. So any type of trauma, physical trauma, chemical trauma, thermal trauma to any part of the respiratory tract can cause coughing. And then lastly, this is rare, but heartworms can cause coughing in cats, even just one heartworm, because cats have tiny bodies, so they can't sustain a very large worm burden. But if they have heartworms, that can cause irritation inside their chest, which can cause coughing. One thing to know, other forms of heart disease in cats don't typically cause coughing. In dogs, coughing is seen a lot with heart disease, but in cats, not so much. So what do you do if you have a cat that's coughing or you've noticed a couple of coughs here and there? Well, the first thing to do is see if there's anything in the environment that could be causing the coughing, something that is irritating to the cat. Sometimes the problem is obvious. Did you get maybe a new cat litter that's too dusty and now your cat's coughing after going to the litter box? Do you use essential oil diffusers or scented candles or strong cleaning products around your cat and then you notice coughing afterwards? When inhaled, any kinds of airborne anything, cleaning products, scented candles, diffusers, incense, all of it can irritate a cat and then they can cough. A more persistent cat coughing, do you smoke in your home? Because secondhand smoke can cause cats to cough and develop asthma and bronchitis. So in these cases, if you can identify specific triggers, stop exposing your cat to these things and see if the coughing resolves. If the coughing doesn't stop or if the cat is acting sick in any other way, schedule an appointment with your veterinarian as soon as possible, because remember, coughing in cats is generally not a normal thing. Treatment for coughing, as you can probably imagine, varies widely dependent on what is causing the coughing. The treatment for pneumonia is totally different than the treatment for cancer, is totally different than the treatment for pleural effusion, is totally different than the treatment for heartworms, is totally different than the treatment for, you get the gist. So if you do take your cat to the vet for coughing, expect that they're going to want to run some lab work, some basic blood work, including a heartworm test. And then they're going to want to take some imaging studies of your cat's chest, most likely chest radiographs, 3 different views. And then depending on what they see there, they may recommend additional testing or they may go straight to treatment. If they suspect it's something like an upper respiratory infection, they may not do any testing at all, and they may just start your cat on some treatment and see how they do. It really depends on the specific vet. So don't be afraid when your veterinarian is recommending testing to say, okay, what are we looking for when we do this? What are you suspecting as the cause of coughing? How will this give you more information so that you can treat my cat? Because sometimes veterinarians will just do things because it's routine. And if you ask them these questions, they may go, well, we might not need to do that today, and instead we could do this. So never be afraid to advocate for yourself and your cat by asking questions. It's your right and your responsibility as a cat owner. How to prevent coughing in your cat. If your cat isn't currently coughing, but you don't want them to cough, there's a couple of different things that you should do. Number 1, don't smoke around your cat. If you smoke outside away from your cat. Cats and birds are very sensitive to secondhand smoke. Dogs are too, but cats and birds specifically. Also, if you have a cat, I would not use any essential oil diffusers around them or incense or strong cleaning products around the cat. If you're going to use these things, put your cat in a different part of the house until you have aired out the place that you're using. I recommend getting yearly checkups on your cat because this can catch any problems early that may cause coughing down the line and more serious problems. I recommend vaccinating your cat appropriately against upper respiratory diseases that can cause coughing. And I recommend using heartworm prevention and also other internal and external parasite control in your cat because some parasites, such as heartworms and also roundworms, if they migrate to the lungs, can cause coughing. And so if you keep your cat on the heartworm prevention, the parasite control, then they're not going to have that issue. If you take them to the vet once a year and have them checked out, they can catch problems early. If you vaccinate them appropriately, they're not going to get these infectious diseases. So that is what I have to say about coughing. There was a lot of information in this. If there's anything missing, please let me know in the comment section. If you've noticed your cat coughing and have experienced the journey of working with a cat with coughing with any of these symptoms, would love to hear about that too. Thank you so much for watching. I'll see you soon.